Hello, let me give you a short overview about the article titled Predictive Value of the Baseline and Early Changes in Blood Eosinophils for Short-Term Mortality in Patients with Acute Respiratory Distress Syndrome. Inflammation is critically involved in the development of ARDS, but the inflammatory phenotypes of ARDS have not been clearly identified. About 14 years ago, eosinophilia was first described as a predictor of pending ARDS. The accumulation of eosinophils in lung was found to be a favorable indicator for ARDS. Eosinophils could ameliorate neutrophilic inflammation and exert a protective effect against ARDS. Therefore, we speculate that eosinophilic ARDS is a distinct phenotype. To date, the predictive value of eosinophils, especially considering longitudinal monitoring data for patients with ARDS, has not been fully elucidated. Therefore, we aim to evaluate the association between the baseline eosinophils changes during the first week in the intensive care unit and shorter patient outcomes. This is a retrospective study based on the Medical database. We studied a total of 1,685 patients with ARDS, and the 13-day mortality rate was 25.1%. Kaplan-Meier analysis showed that patients with high baseline eosinophils had lower 30-day mortality. Random forest model selected the baseline eosinophils as an important factor associated with 30-day mortality. Multivariable logistic regression analysis identified high baseline eosinophils as an independent risk factor for 30-day mortality. The results of the generalized additive mixed model showed that the levels of eosinophils were increased in both survival and non-survival groups, and the between-group differences increased over time, with an average of 0.154 daily after adjusting for confounders. Therefore, our study suggests that there is a negative association between the baseline eosinophils and short-term mortality in ARDS patients, and the differences in eosinophils increased over time between the survivors and non-survivors. Higher increase in eosinophils is associated with decreased short-term mortality, and dynamic monitoring of eosinophils could better predict the survival of ARDS patients.